There goes my baby. You too correct. That's my baby. My food correct. There goes my baby. That's my baby. There goes my. Hello, good morning, good afternoon, good evening. You're welcome for the dancing session. Let's go to the work for today. I'm your resource person, Nurse Don Wokike. Can go to my YouTube channel at Sunday Wokike at YouTube and click on the red button so you can follow up all my videos and you can see comment, ask questions. I will attend to the questions. But if you did not ask, that means you will not, know what is going on. Today, I want to talk about terms used in psychiatry and psychiatric nursing. We want to go far. We want to use the alphabetical arrangement of those terms that you can see whenever you're reading any psychiatric text. Most of those, terms might look confusing. Some of them might also look a bit, unnecessary, just like a jargon to those that are not psychiatric specialists or those that are not in medicine or nursing or any medical field. Today, we want to talk about some terms that are also related to psychology because psychiatric and psychology are son and child. In fact, let me call it son and child. Father and child or mother and child, like sisters and brother. But because why I use the term child and mother is because from psychology, you begat psychiatry. There is a branch of psychology called abnormal psychology, which is purely psychiatry. So most of these terms can also be applied in psychology, and they are mostly used in psychiatry. So when I mention the term psychological disorders, I'm talking about psychiatric illness or mental illnesses. Now I want to start from one term, then to where I will feel or where I might feel that I will stop at, because all the terms are all useful and you also use them, utilize them very well, put them in your brain, and they will come in any exams that you're trying to write that is related to psychiatry or medicine or nursing or any psychology or any other field in medicine. Then I want to start with the term adjustment. Adjustment is just talking about modification of various aspects of self to the demands of daily life. For instance, you are now found in a new environment. The best thing to do is to modify your various aspects of self in order to, fit in to that environment. So you can also adjust to situation, you can adjust to environment, you can adjust to events. That's why we call it adjustment. We have another term known as affect. Affect is an emotion or a feeling. There are some people that, based on their look, you will not be able to understand their intent. So the physical aspect of an individual emotion is what we call an affect. Some people categorize affect as the climate, where the mood is the weather. So it depends on how you're talking about that. So some people are using it because they want to use it to tell you that the climate determines how the mood and the weather will be like. So the mood of an individual is the subjective aspect of an emotion, where the affect is the objective aspect of an emotion. Remember, mark it very, very attentively. Affect is more of objective, while mood is more of subjective. So I've defined two things in one. So I've used one to talk it to things. Then we want to go straight to the next aspect known as agitation. Agitation is an extreme state of restlessness. When you say you're agitated, why are you agitated? That you are restless. Some people, agitation can be too nervous to the extent that their body will be shaking. You'll be having some shaking syndrome, some Parkinson, some Parkinsonic disorderliness. But it's not Parkinson. I'm just trying to, try to draw two lines using the two analogy, telling you how serious the term agitation is. Then we'll talk about ambivalence. Ambivalence is having two opposite emotion to the same object or person. So, like now, this object is here, or in this you'll be having this person is bad, this person is good. Within your mind, you'll be having these two opposite emotion. Within two, you'll be having two positive or either negative feeling. So at that particular point, that individual that you're having that is having that feelings is undergoing what we call ambivalence. Ambivalence. That is opposite, you're having two opposite emotions or feelings to the same object or event or person. Remember, mark it. Then we have what we call amnesia. Amnesia is loss of memory. Loss of memory. In this, we have a retrograde amnesia, anterograde amnesia, retrograde, anterograde. Some are recent, and another one is what? Past. So when you say anterograde, they are talking about recent loss of memory, where retrograde is loss of memory that have, you know, that past, that is past events. So you are trying to be retrospecting, that is to retrospect, to bring back to memory that is past, where retrograde is recent. Just something, tell somebody something and the person forgets. That person is having retrograde amnesia. Where retrograde is person forget about the past events. They will talk about what we call apathy. Apathy is loss of interest. Some people, sometimes you see what we call political apathy, talk about food apathy, talk about sex apathy, that is losing interest in politics, losing interest in food, losing interest in sex. It is a problem also. It is more a challenge in psychiatry or psychology. That's why we bring it into play here. So we can also be using English language apathetic, right? So apathetic, why losing interest in what you're doing, why not showing interest in what you're doing. Then we have to call assertiveness. They say this is the ability of oneself in terms of goal or a particular preference, expressing it appropriately. The ability of oneself to express oneself in terms of goal or trying to be preferential in terms of a particular thing. So that preference will be appropriate in nature. So the ability to express oneself in terms of goal or preferences that is appropriate in nature. So you see that I will be very, very assertive in a particular activity, like in trying to, put more interest, show more concern, trying to express my goal in the field of psychiatry, trying because I have what I want to, achieve in it. So I will make sure that I put all my assertive acumen in it, trying to be very, very assertive. Call it assertiveness, assertive ability to express oneself in terms of goal or preferences appropriately. So you know why you're trying to express this is best known to you. So we have to talk about ataxia. Ataxia is deficiency in muscular coordination due to inefficient supply of a certain hormone called dopamine or abnormality in acetylcholine or every other neurotransmitter that is necessary, hence leading to difficulty in walking. But you can say it is the you can say ataxia is difficulty in walking due to deficient muscular coordination. Remember, it is inability of an individual to walk, move freely because of muscular activity, inability to coordinate the way it's supposed to coordinate. So if your muscular activity is not coordinating normal, definitely there will be an effect in your what motor activity, that is your movement or walking. So that aspect of life or of state of individual or state of being is called ataxia. Then we'll talk about um, autistic thinking. Sometimes you hear the term autistic. This is an individual being occupied with private, self-determined thoughts or action that is only concerned with self, but is not concerned with the reality or is objective to others. So remember, it is not even the thinking is self-determined, and the thinking is not trying to put others into consideration. So you're only preoccupied with your own private thinking, and your thought is determined by your own private action without concern of reality or objective standards shared by others. So what you're doing is based on you, it doesn't concern others. So these are basically manifested with those that have autism. Even I see it in those that have sociopath. Those sociopaths are basically having this autistic thinking, call them histrionic personality. Those that have this histrionic personality, or you see them having this particular manifestation, and, and when they're having this problem, they are putting themselves into consideration, not considering you. So let's talk about the next one, behavioral modification. We're going to letter B. It's a treatment modality used to alter dysfunctional pattern of behavior. Behavioral modification. They will talk about bestiality. Bestiality is just having a sexual intimacy or relationship with an animal. Bestiality, talking about having intercourse with animals. That those that feel happy having sex with animals, they are called bestialists. So we want to go into another term known as circumstantiality. Circumstantiality is talking about communication pattern in which tangential travail details are given. This is for the purpose, remember, this is for the purpose in order to lower the anxiety of the speaker. Put it again. It is a pattern of communication in which tangential travail is given in details. The individual will be talking in a round corner, come back again, boy. Then at that particular point, you will now talk without end. Then, but finally, the point that is what is common in this particular aspect of speech disorder is you must come back to the point upon which you started your speech. For instance, you're talking about election, you will now move a little bit from that particular point of election, you now move straight and go into school education, from education, come back again and put it at where you have to be educated about election. Now you start again, go back to election. So the individual is moving his speech in a circle, like unlike tangentiality where you derail completely from what is being discussed. So I've used this term now to key two things. Sometimes you see the term tangentiality and circumstantiality in psychiatry, basically seen among schizophrenic patients. And these schizophrenic patients that manifest this are those that have gone far. Basically, it can be disorganized schizophrenia, can be paranoid schizophrenia, and other types of schizophrenia that you might also know very soon in this video as we continue. We are what to call compulsion. It's an irrational repetition of an act in order to control anxiety. Remember, compulsion, I will be killing two things: compulsion, obsession. First of all, you think obsession is irrational thought which an individual must be carried out within itself repeatedly. But for you to be free from this obsession, you have to continue it from what we call compulsion. So you have to carry out that your thought so I be free from the anxiety that was placed in by the obsession. I don't know if you understand what I mean. Obsession is obsession is repetitive or ritualistic thinking that potentiates anxiety. Then if the act is not carried out, which is not compulsion, the individual anxiety cannot be relieved. So that is why they say compulsion is an irrational repetitive act that must be performed in order to control what anxiety. So for instance, you have the thought that this your gas, you be in your meeting, like in the meeting with your friends, you say your gas is not off, you now go back and off the gas, you go back again, you now go back and off. So when you do it repetitively, they now say you have an obsessive compulsive disorder, OCD. So it's common with those that have OCD that you can see obsession and compulsion. Then we have what we call confabulation. Confabulation is filling in memory gap with manufactured details. At least for instance, I can be writing an exam or be talking. I will now just manufacture my own terms to fill in the gap. You see, because there is a gap in memory. So I will now fill it in with a term that is not related to what I'm talking about. You say you're confabulating. Why are you confabulating? Like you can say, let me say for instance, let me go to Javu in order to make sure that I achieve what I want to achieve. See, you don't know what Javu is, just a language, just something that within yourself you understand it. I will not use any terms to describe it again, but make sure you capture it. Confabulation, trying to fill a memory gap using your own language that will be that is manufacturing your own language that is best known to you. Deja vu, we have what we call deja vu. Deja vu is also a problem in psychiatry, a sense of having a previous experience, new events, or seeing it before. That is, for instance, you cannot see what you have seen before, you now be having it as a new thing. I don't know if you understand. We have two of them, view and view. View is what you have seen before, then trying to put it as if it is recent. You can now see somebody and you will now see this other person and you see this person is the other person you see having view. Where view is having a previous experience to a new event. That is, I have this new event now. I'll be relating it to what have happened between me and this other person. So you can, or an event that have been that is just new, but you're relating it to what a past event. I don't know if you understand what I'm trying to explain about DJ view and Gemma's view, in case you get it into your question or into any exam or this soon I will be giving you exam in this particular thing. I say a sense of having previous experience new events or seeing it before. Remember, a sense of having previously experienced new event or seen it before. You are having new event as if you have seen it what before. That's just the English language I'm talking there. That is what I'm trying to say there. Forget about my too much psychological or psychiatric languages. Then, well, when you have seen a previous event to be as if you just see it recently, that is called Gemma's view. Then we talk about delusion. Delusion is a fixed false belief that is not real. fixed false belief that is not real. You see somebody, they say, this is my father, this is my brother. This individual is not your brother, but you're claiming is your brother. The patient will say it is the brother. You now know that this person is deluded. You can also see that this person want to kill me, or this group of persons are talking about me, or my thought, what I'm saying, is being shared. It's a types of delusion. When we talk about delusional types, we also put more words into it. Remember what I say? I say the fixed or is a false belief maintained by a client or absence in the absence of the factual evidence, which cannot be corrected using any logical reasoning. It is fixed in the heart of that patient, in the mind of the patient, that you are the father, but you're not. Then we'll talk about dementia is absence or impairment of cognitive and intelligent ability or intellectual ability. The absence of or impairment of cognitive or intellectual ability. When you are lacking intellectual ability, you are having dementia. You were having intellectual ability intact, but there is an impairment. You're dwelling from being normal to being dementic. Remember, this can manifest in people that have dementia, Alzheimer's disease, things like Parkinsonism or Parkinson disease. We have what we call depersonalization, feeling of unreality or disconnection from self. You see an individual that is you think that is not me. I am not Dominic. I am another person. Remember, let me put in another terms again. We also call nihilistic delusion, under delusion. So it's feeling that the part of my body is not there. We have derealization, depersonalization. Here in derealization, you are feeling that a particular thing that is happening or an event that is occurring is not occurring to you. Then you are having the realization, the inability to realize the, the event that is occurring in an individual personality. Then we have what we call dyslexia. Dyslexia is impairment or impaired ability to read. We have this inability to calculate appropriately or use of arithmetical words or terms. We have what we call dysgraphia, inability to write. Those that have writing disorders or learning disorders, you see them, most of them don't have the ability to write, they don't have the ability to read, they don't have the ability to calculate. You see, this person is having learning disorder. We have what we call disorientation, confusion to time, place, or person. You must be your judgment in these three perspectives, these three spheres of life must be impaired before we say you are disoriented. Time, person, and place. Where am I? I am in Lumosi. Where you are in Lumibo Psychiatric Hospital. Where am I? What is the time? Is it morning or afternoon? Say it's morning. Where is afternoon? Who is this? Says my son. There is your husband. You are having disorientation. Remember, these are things that can happen in a dementic patient. Also, the patients that have dementia or Alzheimer's disease or Huntington disease or patients that have Parkinsonism. Then we have echolalia. Echolalia is repetition of word heard. You hear John, the patient will echo John, John, John. The person will be repeating it. This is common with schizophrenic patients. Also, we have echoprasia, repetition of action seen. Echoprasia is just like trying to repeat what somebody have done. If I dance, you repeat it. You don't be dancing, dancing, dancing repeatedly because you have seen me dancing. Then it's also common with schizophrenic patients. We have what we call empathy. Empathy is the inability to understand the feelings of others. Trying to put is the ability to understand the feeling of others, putting oneself into another person's position. Some people used to say that putting yourself into another person's shoe. You will now be able to know how tight the shoe is, that you're trying to become empathetic, understanding the feeling of the other person. Not does not only end by understanding. You have to put yourself into that individual's position. You are trying to be what? Empathetic. It's different from sympathy. Sympathy is trying to feel the other person's thoughts. That is trying to understand the feeling of the other person. Then, but you can only try to envisage or try to feel the individual's feeling, understand the individual feeling, but you cannot put yourself into the individual's position. You are only sympathetic, you are not empathetic. While in medicine, nursing, psychology, a patient caregiver, or let me say a caregiver or a care provider must be empathetic. You must put yourself into that individual position for you to know what that individual is feeling, and you know how to bring the individual out of the problem. That's why you call it empathy. Euphoria and exaggerated feelings of well-being and pleasure. You be euphoria, can take some psychedelic drugs, some hallucinogens. You see yourself being very, very euphoric, happy, elated, and you don't know that you're going. And it is common among those that have mania. Sometimes you can see euphoria. Those that have schizophrenia also, you can see it in them. But basically common by bipolar affective disorder, mania, affective disorder like mania, and bipolar affective disorder, and some schizoaffective disorder. So we still have flight of idea. This rapid movement from one topic to another. Rapid movement from one topic to another. Uche is trying to go to school. You just move. But when the church time reach, I will still be able to understand that the man is teaching. You are going rapidly. There is flight of idea. You're not there again. Your thought, your movement of thoughts have gone beyond where you're supposed to go. You have gone to another area where we are discussing. We have idea of reference. Believe that certain events or objects have a special meaning. It's all that delusional types. Idea of reference, that is delusional of reference also. Okay, I say that this particular topic that these people are talking have a significant meaning to yourself. So you can say that significance or inference to oneself to a particular topic that is being discussed by others. Then you can talk about insight. Insight is the ability to recognize and understand the connection between behavior, motive, and feeling. The ability to understand understand the connection between motive, behavior, and feelings. Remember, we have talked about behavior, motive, and feelings. So why is this action being taken? Is because of this. So you're able to understand the behavior, the connection between that behavior and the purpose why that behavior is being carried out, with the feelings why it should be carried out. So that's what we call insanity. Insanity is just going to talk about what a synonym for what? Mental illness. It's a synonym for mental illness. When you say insanity, this person is insane, you have mental illness. It's a formal name for mental illness. I used to call it like we have what we call negativism, carrying out opposite of instruction. Refusal to follow instruction, doing what others are not doing, trying to be a sadist. That is, whatever thing you are doing is contrary to what the general are doing, or feeling different from what the generals are feeling. That is called negativism. Some people can call it sadist. Some people can call it anything. You can still get the term known as psychodrama. They say the use of dramatization is a therapeutic model or treatment modality using a dramatization under professional direction to help clients act out life experience before an audience or peer who offer constructive alternative suggestions for coping. So it is a method used in treatment in psychiatry where you act out your feelings, act out your character, so that others or peers or audience can see it, and when they see it, they will not see that you are trying to dramatize what you were feeling. And some persons can use that particular treatment modality and come out of that feelings. So you can say it's a form of psychotherapy actually. Call it psychodrama. Yes, it's a form of psychotherapy. You can still get the term psychotherapy, like talk therapy. The use of it's a treatment modality where an individual uses talk, that is treatment modality which is not directed towards the use of drugs rather than use of talk in order to bring out an individual from his problem. So we have psychotherapists, they are individual trained for carrying out psychotherapeutic intervention or treatment modalities. So psychotherapy is a very broad topic that I also discussed here. We have what we call formal and informal aspect of it to be discussed later. I don't want to go far. I want to talk more on that. We have what we call hypnagogic hallucination. Remember, let me talk about hallucination. Hallucination is false perception which is not real. Remember, perception takes place within the five sense organs. You have things like seeing what others are not seeing. You can say you're having a visual hallucination. Hear what others are not hearing. You're having auditory hallucination. And feeling what others are not feeling in your skin. And say you're having another form of hallucination that is different from what others are seeing. You see that your feelings are not the same with others. So you can see have different types of hallucination. Now we'll talk about hypnotic hallucination, misinterpretation occurring when patient is waking up from sleep. Hypnotic hallucination. When you're waking up from sleep, then there is a trivial occurrence where I will try to misinterpret something. Then say hypno. Then we have all hypnologic. This one occurs. It's also a misinterpretation occurring when a patient is falling asleep. Hypnagogic is occurring when they are falling asleep, where hypnotic hallucination is happening when you are waking up from sleep. Remember, we have to call flattening of affect. I've talked what affect is. It's a feeling of indifference. We call it blunt affect. Talk about anterograde amnesia, loss of memory after an adverse event, where retrograde, loss of memory for things that occur before an adverse event. I've mentioned it before. Thought withdrawal, a feeling that one's thought has been removed. Thought insertion, feeling that thought is being imposed by an external force into an individual's mind. We have what we call thought focus, feeling that one's thought is escaping and is being experienced by another person. These are things that happen to patients. We have what we call psychomotive retardation, the slow down of body movement. So that you can see psychomotive retardation, you're talking about the slow down of body movement. There are a lot of terms that have not been mentioned here that will still be, mentioned, which if you want to ask question on it, you can still ask a question. I will still answer you. Thank you. Make sure you subscribe. As you subscribe, I'm going to appreciate you by giving you more video about psychiatry, psychology, and psychiatric medicine and psychiatric nursing, so that you can be able to have knowledge about it. For those that are psychiatric assistants, those that are working as assistants in a facility, in a psychiatric environment, you have this knowledge. Please make sure you subscribe so that you can use this particular video, this knowledge as your working document. For students that are doing psychiatry, students that are having psychiatric experience, either in medicine or in nursing or in any field, or in psychology, those that want to have in psychological practicum can also listen to this video to help you Thank you and God bless you as you subscribe. Please subscribe. Please subscribe.